Hello, welcome to our presentation on the implementation analysis of case management interventions for frequent users of healthcare services, a multiple case study. My name is Alana Delahunty-Pike, and I am based out of Dalhousie University in Halifax, Nova Scotia, Canada. We also have Catherine Houdon, who is our nominated principal investigator, who is based out of University of Sherbrooke in Sherbrooke, Quebec, Canada. Catherine will be here for our question and answer period at the end of this presentation.
And my name is Charlotte Schwartz. I'm based out of the University of New Brunswick in St. John, New Brunswick, Canada. So this project is part of the PriCARE program, and PriCARE studies the implementation of a nurse-led case management approach for patients with one or more chronic conditions and complex care needs who are frequent users of healthcare services. PriCARE is taking place in primary care clinics across Canada, including Quebec, Nova Scotia, New Brunswick, Saskatchewan, and Newfoundland and Labrador. This study focuses on frequent users of healthcare services and individuals with chronic conditions and complex care needs. Individuals with complex care needs require a variety of services from various systems, including health, social, educational systems, and community networks. This can lead to difficulties with the integration of care. Case management is a collaborative approach used to assess, plan, facilitate, and coordinate care to meet individual, patient, and family healthcare needs. This is done through communication and available healthcare resources, including community, primary, and secondary care, as well as sectors outside of the health system, such as social services and housing, with the intent to improve individual and health system outcomes. And here you can see a diagram of the case management intervention, which lays out the 4 main steps to the intervention.
While previous studies indicate that a case management intervention, or CMI, is effective, knowledge gaps still exist regarding the following: the barriers and facilitators to CMI for frequent users of the healthcare system, as well as documenting CMI implementation in primary care with a standardized intervention across clinics, types of healthcare providers involved, as well as types of patients involved. This project will address the above-mentioned gaps. The aim of this project was to determine barriers and facilitators of the implementation of a case management intervention in the primary care setting where respondents were based. So we did an implementation analysis for this project. It was a qualitative multi-case study, including 6 cases in 4 of the 5 provinces involved. So those provinces were Nova Scotia, New Brunswick, Newfoundland and Labrador, and Quebec. We also performed in-depth semi-structured interviews and focus group discussions with nurse case managers, family doctors, nurse practitioners, other providers, and clinic managers. There were several barriers to the implementation of case management in primary care clinics identified. The first being a negative perception of the intervention from providers. So perceived increased workload, a pressure on the nurse case manager, an increased pressure, skepticism regarding the need for the program, and evidence to support it. We also identified interorganizational collaboration struggles as a barrier, with lack of resources and community supports outside of the clinical setting. A lack of access to patient medical records and charts was also a barrier, with varying access to electronic medical records. There were challenges with patient identification and recruitment, with the difficulty contacting and recruiting patients who meet the study criteria, as well as a lack of guidance on how to recruit patients. The required time for primary care nurses in the short term to get case management up and running was perceived as a barrier. There was concern again around increased workload, staff shortages, difficulty prioritizing tasks, and increased demand. There were also some challenges anticipated with planning and organizing the individualized services plan, identified as a barrier. This was perceived as difficulty bringing providers together, concerns regarding providers' interest in or time to engage. And the individualized services plan is essentially the case management plan that's made with the patient. And the meeting typically would involve the patient, the nurse case manager, family doc, and nurse practitioner if they are involved in the circle of care, providers and specialists, as well as any community partners or individuals that might be involved or could become involved in the patient's care. Finally, there were challenges anticipated with patients' motivation, with limited access to care due to remote geographical location, certainly in some rural clinics this was the case, and some health literacy issues as well.
There were also several facilitators to the implementation of case management in primary care clinics, which were identified. The first facilitator was a positive perception of the intervention from providers. So providers saw case management as a comprehensive, adaptable approach to care, providing increased resources for patients. Further, they saw it as a more organized way to do activities that are already performed. Another facilitator identified was a culture of patient-centeredness. So in the case management approach, the patient is included in communication between the providers, and providers support patient self-management. Managerial leadership, engagement, and support was identified as another facilitator. This can include providing an introduction of case management and planning for the implementation amongst clinic staff. Clinical and research engagement and support was another facilitator. This included training and community of practice for nurse case managers. Capacity development was another facilitator to the implementation of case management. This included team meetings to plan and organize the implementation of case management intervention and debriefing with providers after the first interdisciplinary service plan meeting. The nurses themselves were also a facilitator to case management. Having trained, skilled, and experienced nurses as case managers was seen as a facilitator. Finally, there were strategies identified to facilitate recruitment. For example, family physicians could introduce patients to nurse case managers to help establish a trusting relationship between patients and nurse case manager.
This is the first study to identify barriers and facilitators of a standardized case management intervention, CMI, implementation for frequent users of healthcare services across multiple primary care clinics. Case management was generally perceived as time-consuming, but certainly beneficial, and nurse case managers require extra time in the short term to complete the case management intervention. The patient-centered approach of case management was considered to be one of its greatest strengths. The presence of a qualified nurse case manager, as well as training and support from the research team, can help facilitate the implementation of case management. And finally, it is crucial to consider how the challenges of the implementation of case management, including recruitment methods and inclusion and exclusion criteria, can be adjusted to overcome the difficulties related to the implementation of case management within primary care in a research context. This is the list of our team members, which hail from Newfoundland and Labrador, New Brunswick, Nova Scotia, Quebec, and Saskatchewan. And we'd also like to highlight and thank our very generous funders and our many partners that are involved in this study. And finally, we'll open it up to the question period. Thank you very much for listening.